Okay, let's unpack this. Right now, we're diving deep into a stack of sources. We've got articles from various news outlets, a crucial update directly from the CDC, and they all converge on one absolutely massive, eye-catching number: 1.7 million dozen eggs.
Yeah, 1.7 million dozen. That number really stops you in your tracks, doesn't it?
It really does.
That's 20,400,000 individual eggs.
Yeah.
It immediately signals that whatever this is about, it's not a small, localized issue.
No, wait.
It has significant scale and potential reach.
Exactly. It's a number that just screams, pay attention. And these aren't just any eggs. They are linked directly to a widespread, multi-state Salmonella outbreak that has already made people sick.
A lot of people sick.
Yeah. So for this deep dive, our mission is crystal clear. We're going to sift through these sources, cut through any confusion or, noise,
Right.
and pull out only the absolutely essential, need-to-know information that helps you, the listener, understand exactly what's going on.
It's about getting you the critical facts quickly and clearly. We want to cover, exactly which specific eggs are involved,
And where they were sold.
what the potential risks are, what the details of this outbreak look like, according to the health authorities,
Yeah.
and most importantly, the practical steps you should take right now if you think you might have these eggs in your refrigerator.
Right. Think of this as your shortcut to being well-informed about a potentially serious public health issue that could affect what's currently in your kitchen.
Definitely.
And here's where it gets really interesting. As that massive number implies, this isn't just some isolated incident happening in one small town.
No.
This recall has a nationwide footprint, and the outbreak has impacted multiple states across the country. So let's jump right in and get a handle on the sheer scope of this recall. What exactly are we talking about being pulled off the shelves?
Absolutely. As we said, the headline figure is that staggering 1.7 million dozen eggs being recalled.
Over 20 million eggs. It's just incredible. And who is the supplier behind this recall? Who produced these eggs?
So the sources identify the company responsible as August Egg Company. They're based in Hillmar, California.
Fullamar, California. Okay.
Yeah, they are the origin point for this massive quantity of recalled eggs.
Okay, so August Egg Company in California, we know the huge number, but it's not all eggs that August Egg Company produces, is it?
No, that's a key point.
What specific types of eggs are covered by this recall? This is like super crucial for anyone checking their fridge.
It absolutely is. The recall is quite specific. It targets only brown, cage-free eggs and brown certified organic eggs.
Okay, just those two types.
Right. So if you have white eggs
Sure.
or, conventional brown eggs or eggs labeled otherwise, according to the sources, they are not part of this specific recall.
Gotcha.
It's essential to focus on those two categories: brown cage-free and brown certified organic.
That distinction is really important. It helps narrow things down immediately. Now let's get super practical for the listener. If someone has brown, cage-free, or organic eggs, how do they know if they have the specific eggs from August Egg Company that are subject to this recall?
Right.
What are the crucial identifiers they need to look for?
This is arguably the most critical piece of information for you to take action. You must check the egg carton.
Okay.
These specific recalled eggs can be identified by two pieces of information printed right there on the carton.
Okay, what are those two things?
The first thing to look for is the plant code number.
Plant code.
Yeah, this is a code that identifies the facility where the eggs were processed and packed. There are two specific plant codes associated with this recall: P6562 or CA5330.
P6562 or CA5330.
Exactly. These are official identification codes used by, federal regulators for tracking food products.
Right.
If your carton has either of these codes, that's the first necessary match.
Okay. P6562 or CA533. So if you see one of those codes on your brown, cage-free, or organic egg carton, you're partway there. Is that enough to know they're recalled?
Nope, not quite. You need the second identifier, which is the Julian date.
Julian dates. Okay.
The recall applies to eggs packed within a specific range of Julian dates, between 32 and 126.
The Julian date. Sometimes people aren't familiar with that number on the carton. Can you quickly explain what that represents again?
Sure, yeah. The Julian date is typically a 3-digit number printed on the egg carton that indicates the day of the year the eggs were packed.
Ah, okay.
So January 1st is 001, January 2nd is 002, and so on.
Makes sense.
So Julian date 32 would be the 32nd day of the year, which is February 1st, assuming a non-leap year for simplicity in these examples, but the idea holds.
Right.
And Julian date 126 would be the 126th day of the year, which lands on May 6th or May 5th if it's a leap year.
Got it.
It's basically just a sequential date stamp for the packing day.
Got it. So it gives you the day of the year they were packed. That makes sense. So to confirm you have the recall eggs, you need both the specific plant code, P6562 or CA533, and a Julian date that falls anywhere between 32, which is Feb 1st, and 126, which is early May.
That's it.
If your carton matches both of those criteria, those are the eggs subject to the recall.
Exactly. That combination is the definitive way to identify the affected product from August Egg Company. It's printed right there on the carton, usually near the sell-by date.
And these eggs weren't just sold under the August Egg Company name, right? The sources list a whole host of popular brand names under which these recalled eggs were distributed.
Yeah, that's really important.
It is, because people might not even realize they're buying from August Egg Company. What names might they see?
Absolutely. This is another layer of identification for consumers. The list of brand names mentioned in the sources under which these brown cage-free or organic eggs were sold includes Market Side.
Okay, that's a big one.
Yeah. Also Rayleigh's, Ori Organics, Clover, First Street, New Laid, Simple Truth.
Simple Truth, okay.
Sun Harvest, and Sunnyside.
Wow, that's a pretty extensive list of well-known brands. So if you've bought brown cage-free or brown certified organic eggs under any of those names, and you're in one of the states we're about to discuss for distribution, you absolutely need to take that carton out and check those plant codes and Julian dates.
Correct. The brand name is a good initial flag, maybe, but the plant code and Julian date are the definitive identifiers for the recall itself.
Got it.
It's also worth noting, the sources mention that this recall isn't limited to just the dozen egg cartons.
Oh.
Yeah, it also includes loose eggs, small, medium, large, and jumbo size, brown cage-free and organic varieties sold in cases or flats.
Ah, okay, so that could affect businesses.
Exactly. This is particularly relevant for businesses, restaurants, maybe caterers, or people who buy eggs in bulk.
Right.
The same plant codes and Julian dates apply, though checking those might require finding the original case packaging.
Or maybe contacting the supplier.
Or contacting your supplier if they were purchased loose, yeah.
Okay. That covers what was recalled and how to identify it. That 1.7 million dozen number, paired with the list of brands and the specific codes, really brings home the scale of this thing. It's not abstract, it's about checking your own groceries.
It certainly makes it very real, doesn't it? Knowing the specifics helps you cut through those, general food scare headlines and see if this actually impacts you.
Absolutely. Okay, so we know what eggs are recalled and how to identify them. The next crucial piece of the puzzle is where these eggs ended up. Section 2 is all about the geographic reach.
Yes, and this is where the multi-state aspect really comes into play. As we mentioned, this is characterized as a nationwide recall.
Nationwide, wow.
Meaning the affected eggs were distributed far beyond the company's base in California.
And the sources give us specific date ranges for when these eggs were distributed and what their sell-by dates were. This helps people narrow down if the eggs they bought during a certain period might be affected, even if they've already, say, tossed the carton.
They do. The sources break down the distribution and sell-by dates, which slightly varies depending on the distribution channel, it seems.
Okay.
So the first batch of eggs that were recalled were distributed between February 3, 2025 and May 15, 2025.
Okay, Feb 3rd to mid-May.
Right. These eggs had sell-by dates ranging from March 4, 2025 through June 4, 2025.
March 4th through June 4th sell-by dates. So distributed over a roughly 3.5-month window in the spring, with sell-by dates that would have been relevant up until, well, pretty recently, depending on when you're hearing this.
Exactly.
Where were those specific eggs sold? The ones with the sell-by dates up to June 4th.
According to the information from the sources, that first batch was primarily sold at specific retailers located in California and Nevada.
Just California and Nevada for that first batch.
Seems like for that specific set of sell-by dates, those retailers are listed as Save Mart, Food Max, Lucky, Smart and Final, Safeway, Rally's, Food 4 Less, and Ralph's.
Okay, a lot of West Coast chains there.
Mm-hmm.
Got it. So if you live in California or Nevada and purchased brown, cage-free, or organic eggs from one of those stores between early February and mid-May, and the sell-by date was June 4th or earlier, those are the eggs you need to check the codes and dates on.
Exactly. Now, there's a second batch with a slightly different distribution footprint and sell-by date range.
Okay.
These eggs were distributed between February 3, 2025 and May 6, 2025.
Oh, so the same start date, February 3rd, but the end date for distribution is a little earlier, May 6th instead of May 15th.
Right, a slightly shorter distribution window listed for this batch.
And their sell-by dates, did they also end around June 4th?
No, see, their sell-by dates actually extended further out.
Yeah.
March 4, 2025 through June 19th, 2025.
June 19th. Okay, that's a significant difference.
It is. So these eggs could have potentially still been on shelves, or at least still relevant in someone's fridge, for another couple of weeks beyond the first batch's sell-by range.
Okay, that's a really key difference in the sell-by window. And where were these eggs sold? This is where the multi-state reach really expands, right?
This is where it gets much broader. This second batch was primarily sold through a single, very large retailer, Walmart.
Ah, Walmart. Okay, that explains the reach.
Exactly. And this distribution reached far more states than the first batch. These eggs were sold at Walmart locations in California, Washington, Nevada, Arizona, Wyoming, New Mexico, Nebraska, Indiana, and Illinois.
Wow. Okay, let me list those again. California, Washington, Nevada, Arizona, Wyoming, New Mexico, Nebraska, Indiana, and Illinois.
That's 9 states.
That takes it from the West Coast and a bit into the Southwest, stretching into the Mountain States and then right into the Midwest. That's 9 states just through Walmart, plus the specific retailers in California and Nevada mentioned for the first batch.
Correct.
So the recall definitely has a broad geographic impact.
It absolutely does. The sources confirm distribution across at least 9 states in total when you combine all the retailers mentioned for both batches. This really highlights just how interconnected our food supply chain is.
Yeah, definitely.
And how quickly a product from one facility in California can end up on shelves thousands of miles away.
It really makes you think about the logistics involved. So for anyone listening in any of those 9 states, California, Nevada, Washington, Arizona, Wyoming, New Mexico, Nebraska, Indiana, or Illinois, or if you bought eggs from those specific California, Nevada retailers like Safeway or Raleigh's, you should definitely consider checking your brown, cage-free, or organic eggs using those plant codes and Julian dates we discussed.
Absolutely.
Knowing the state and retailer where you bought them helps you know if you're potentially impacted before you even look at the carton.
It's a crucial step in narrowing down your personal risk, yeah.
Okay, we've covered what eggs were recalled, how to identify them with the codes and dates, and where they were sold geographically across multiple states and retailers. Now for the absolutely critical question, why? Why was this massive recall necessary? What prompted this action?
Right. This leads us directly to the why behind the recall. The eggs from August Egg Company are directly linked to a multi-state outbreak of Salmonella infections,
Salmonella.
specifically caused by a type known as Salmonella enteritidis.
Salmonella enteritidis. Can you give us a quick refresher on what Salmonella is and why it's a concern? Like, what actually happens?
Certainly, Salmonella are a group of bacteria, tiny germs, that are actually quite common. They live in the intestines of birds, like chickens, as well as people and other animals.
Okay.
They are a really significant cause of foodborne illness or food poisoning worldwide. When people ingest these bacteria, typically through contaminated food like these eggs, or contaminated water,
Or even animals.
or sometimes direct contact with infected animals or their droppings,
Yeah.
they can get sick. The bacteria basically set up shop in your gut and cause inflammation.
Okay. And this particular outbreak linked to these specific eggs, how many people have gotten sick according to the numbers reported by the CDC and health officials in the sources?
So as of the date the sources were compiled, the CDC reported a total of 79 people who have fallen ill with salmonellosis as part of this specific outbreak.
79 people sick. That's quite a few. And what about hospitalizations? Did anyone get sick enough to need hospital care?
Yes, unfortunately. The reports indicate that 21 individuals required hospitalization due to their salmonella infection from this outbreak.
Wow, 21 out of 79 needed to be hospitalized.
Yeah, that's a significant percentage, over a quarter. It really highlights the potential severity of these infections for some people.
It really does. That underscores why this recall is so important. Were there any deaths reported linked to this outbreak?
Thankfully, the sources state that as of their publication date, no deaths had been reported in connection with this specific outbreak.
Okay, that is definitely a relief, even with the number of hospitalizations. Now, the sources also mention how many states have confirmed illnesses from this outbreak, which is slightly different from the states where the eggs were distributed, right? You mentioned 9 distribution states earlier.
Yes, that's an interesting detail highlighted by the CDC information. While we know the eggs were distributed to at least 9 states, through those retailers.
Mhm.
The confirmed outbreak cases, where people were interviewed and tested positive with matching Salmonella strains, were reported across 7 states.
So potentially 9 or more states receive the eggs, but only 7 states have confirmed illnesses linked to this outbreak so far. That does raise a question, why the difference?
Yeah, it's interesting. The sources don't explicitly explain why the outbreak cases are concentrated in 7 states while the product went to more.
Could be a few reasons, I guess.
It could be related to varying levels of surveillance and reporting across states, maybe different consumption patterns, or maybe illnesses just haven't been linked yet in those other states. It's hard to say from the info we have.
Right.
But regardless, the confirmed illnesses, which trigger this whole investigation, are documented in those 7 states.
Okay. We rely on what the sources tell us, and the confirmed illness data points to those 7 states being directly impacted by the sickness. Now, let's get into the public health detective work. How did health officials manage to connect these 79 illnesses, spread across 7 states, back to these specific eggs from August Egg Company in California? That seems like finding a needle in a haystack.
It is a complex process, definitely, and the sources outline the key steps involved. It really starts with the people who get sick.
Right, the patients.
Yeah. Health officials conduct detailed interviews with sick individuals to gather information about everything they ate and where they were in the days or week before they became ill.
So they're essentially asking the sick people for clues about a common exposure, like, what did you all eat?
Precisely. They look for patterns. In this outbreak, out of the 30 sick individuals who were interviewed in detail,
Okay, 30 interviews.
a remarkably high number, 27 of them, reported consuming eggs or a dish containing eggs in the days leading up to when they got sick.
27 out of 30. Wow, that's a very strong signal, isn't it?
It's huge. That would immediately tell investigators, okay, eggs are highly likely to be the culprit here.
Yeah, no kidding.
Absolutely. That kind of strong dietary link in patient interviews is crucial in narrowing down the source of an outbreak. So, with eggs identified as a likely common factor.
They look at where the eggs came from.
Exactly. The investigation then focused on where those eggs might have come from. The FDA, the Food and Drug Administration, which is responsible for the safety of eggs in the shell,
Right.
then conducted an inspection at the August Egg Company processing facility in Hillmar, California.
And what did the FDA inspection involve? Were they just like looking around, checking paperwork?
No, it's much more hands-on than that.
Yeah.
As part of the inspection, the FDA team collected environmental samples from the facility.
Like swabs?
Yeah, exactly. Swabbing
Yeah.
surfaces, equipment, areas where eggs are handled, looking for the bacteria in the environment.
Yeah.
And they also collected samples of the egg product itself.
Okay. And the testing of those samples revealed what? Did they find it?
They did. Some of the samples taken from the facility, both environmental swabs and potentially some egg samples, tested positive for Salmonella.
Okay, so they found salmonella at the facility. But how do they know it's the same salmonella that's making people sick across multiple states? That's the final link, isn't it? That seems key.
That's right. That's the crucial step where the puzzle pieces really fit together. Finding Salmonella is one thing, but linking it is another.
So how do they do that?
The Salmonella bacteria found in the facility samples undergoes sophisticated laboratory testing. This testing, often involving genetic analysis or what they call DNA fingerprinting.
Oh, cool. Like for crime scenes?
Kinda, yeah. It allows scientists to determine the specific genetic makeup, the specific strain of that Salmonella.
Okay.
And the sources state that this additional testing found that the Salmonella isolated from the facility samples was closely related genetically to the Salmonella strains isolated from the stool samples of the people who got sick.
Ah, the genetic match. That's the smoking gun then. Connecting the specific bacteria found at the source facility directly to the bacteria found in the patients who fell ill.
Exactly. That genetic evidence provides compelling scientific proof linking the product from that facility to the outbreak illnesses.
Wow.
It confirms that the Salmonella causing this sickness originated from, or at least was present in, the August Egg Company facility. This critical connection is what allowed public health agencies to confidently identify the source and trigger this extensive recall.
That makes total sense.
It's a powerful example of how modern public health surveillance systems work, combining patient reporting, boots-on-the-ground inspection, laboratory testing, and that cutting-edge genetic science to trace illnesses back to their source in our very complex food system.
That is truly fascinating how they connect those dots across states and across different parts of the food chain. Just amazing work. So we understand the link. Now let's make sure everyone listening understands what a salmonella infection or salmonellosis actually feels like. What are the typical symptoms people should be aware of if they think they might have eaten these eggs?
Right. Understanding the symptoms is key to knowing if you've been affected or if someone you know has. We've already touched on how it spreads primarily through contaminated food like these eggs.
Yeah.
The typical symptoms of salmonellosis, according to the sources, include diarrhea, which can sometimes be quite severe,
Straight diarrhea.
fever, and stomach cramps like abdominal cramping.
Right.
People might also experience nausea and vomiting.
Okay, so diarrhea, fever, cramps, maybe nausea and vomiting. Those seem to be the most common signs to watch for. How quickly do those symptoms usually start after someone is exposed to the bacteria? Is it immediate, like you eat the egg and feel sick right away?
Not usually immediate, no. The sources state that symptoms typically begin anywhere from 6 hours to 6 days after a person swallows the Salmonella bacteria.
6 hours to 6 days? That's a pretty wide window.
It is. So if you ate potentially contaminated eggs, you might not feel sick for several days afterwards. That incubation period can sometimes make it tricky to pinpoint the source without careful investigation, like they did here. Connecting what you ate Tuesday to feeling sick Saturday.
Yeah, that makes sense. Okay, 6 hours to 6 days for symptoms to start. And once they do, how long does the illness usually last for most people?
For most healthy individuals, the symptoms are definitely unpleasant, uncomfortable, but generally resolve on their own within about 4 to 7 days.
4 to 7 days?
Yeah, without requiring specific antibiotic treatment usually. Your body typically fights it off.
So typically a week or less of feeling pretty unwell for most people. However, the sources, particularly the CDC guidance, really emphasize that certain groups are at a much higher risk for developing severe illness.
Yes, absolutely.
Who are those vulnerable groups?
Yes, this is a critical distinction to make. The CDC information points out that young children, specifically those younger than 5 years old,
Okay, little kids.
adults, 65 years and older,
Teen-
and people with weakened immune systems are much more vulnerable to severe salmonella infections.
Weakened immune systems. Like people undergoing cancer treatment or with HIV or other conditions?
Exactly. Or people on certain medications that suppress the immune system.
Okay. Why are these groups more susceptible to a worse outcome? What happens?
Well, their immune systems are either still developing, like in young children, or naturally declining with age in older adults, or, as you said, compromised by underlying health conditions or treatments.
Right.
This just makes it harder for their bodies to fight off the infection effectively and contain it to the gut. So there's an increased risk that the bacteria could spread from the intestines into the bloodstream or other parts of the body.
Oh, okay. That sounds serious.
It can be very serious, leading to more severe, sometimes life-threatening complications that absolutely require medical attention and often hospitalization.
Yeah.
And that lines up with what we saw, right? The 21 hospitalizations in this outbreak likely included people from these higher-risk groups.
That makes the risk to these groups very clear. And even for generally healthy individuals, there are signs that the infection might be becoming severe and warrants calling a doctor. The sources list specific severe symptoms people should watch out for. What are those red flags?
Yeah, the CDC is very clear on this, and it's good information for everyone. You should contact a healthcare provider if you experience any of the following severe symptoms.
Okay.
First, diarrhea accompanied by a high fever specifically. A fever higher than 102 degrees air or 39 degrees C.
Okay, 102 Fahrenheit. That's pretty high.
It is. A fever that high, along with diarrhea, is a sign your body is fighting a more significant infection.
Got it. What else?
Second, diarrhea that lasts for more than 3 days and is not showing any signs of improvement. Just persistent, unrelenting diarrhea.
Okay, so high fever with diarrhea or diarrhea that just won't go away after 3 days. What else indicates a more serious situation?
Bloody diarrhea is another major warning sign.
Oh, okay.
Yeah, seeing blood in your stool. This can indicate significant inflammation or damage to the lining of the intestines.
That definitely sounds like a call the doctor moment.
Absolutely. Also, vomiting that is so severe and frequent that you are unable to keep any liquids down at all.
Oh man. Inability to keep liquids down? That sounds like it could quickly lead to dehydration, right?
Exactly. And signs of dehydration are explicitly listed as severe symptoms requiring medical attention.
What are those signs? How would you know?
The key signs include not urinating very much, like a significant decrease in how often you pee or how much comes out.
Okay.
having a very dry mouth and throat,
Makes sense.
and feeling dizzy or lightheaded, particularly when you stand up from sitting or lying down.
Ah, that dizziness when standing. Got it.
Yeah, those are all indicators that your body is losing too much fluid and electrolytes and needs help rehydrating, possibly with medical intervention.
So to recap those severe symptoms again, high fever with diarrhea over 102 degrees F, diarrhea lasting more than 3 days without improvement, any bloody diarrhea, severe vomiting where you can't keep liquids down, or those signs of dehydration like reduced urination, dry mouth, or dizziness when standing.
That's the list.
If you experience any of those, the advice is clear. Call a doctor.
Absolutely. While most cases are mild and resolved on their own, being aware of these specific severe symptoms, especially if you have vulnerable people in your household, is crucial for knowing when to seek professional medical help promptly.
That information is incredibly important for everyone listening. Knowing the symptoms and, crucially, when to get help is vital. Okay, now let's get to the most direct and actionable part for you, the listener. Section 5, what you should do right now.
Yes, this is the core message, really. If you have brown cage-free or brown certified organic eggs in your refrigerator,
Okay.
and you've checked the carton and confirmed they have one of the recalled plant codes, that's P6562 or CA533
Right.
and be a Julian date between 32 and 126.
The absolutely clearest instruction from all the sources is do not eat them, period.
Precisely. The guidance is unequivocal. Do not eat any eggs identified as part of this recall. Full stop.
Okay, so you've checked and you have them. You know not to eat them. What should you do with them? Just leave them there.
No, definitely not. You have two main options provided in the sources. You should either throw them away immediately.
trash them.
Yeah, preferably into a sealed trash bin to prevent any potential cross-contamination risks or pets getting into them or anything.
Good point.
Or the second option is you can return them to the store where you purchased them.
Ah, for a refund.
Usually, yes. Most retailers involved in recalls like this will offer a full refund, even without a receipt sometimes, though it's probably best to check with the specific store's policy just in case.
Okay, throw them away or return them for a refund. Got it. What if someone, perhaps unknowingly, transferred the eggs from the original carton into like one of those plastic fridge egg holders?
Yeah, that happens.
Or they bought them loose from a flat at a store and don't have the packaging with the codes anymore, but they know they bought brown cage-free or organic eggs from one of the listed retailers during that affected time frame. What then?
That's a really common scenario, and the sources address this. The advice is pretty straightforward. If you have brown, cage-free, or brown certified organic eggs in your fridge, and you cannot verify the plant codes or Julian dates because you don't have the original packaging,
Yeah,
the recommendation is to throw them away to be safe.
just toss them out.
Yeah. Given the confirmed link to the outbreak and the large scale of the recall, the official guidance leans towards caution. It's better to err on the side of safety and dispose of the eggs if you cannot definitively rule them out. When in doubt, throw it out.
Safety first makes perfect sense here. Okay, crucial question that often comes up with egg recalls. Can you just cook the eggs really, really thoroughly? You know, like hard boil them or scramble them till they're super well done. Doesn't high heat kill salmonella?
That is a very common and, frankly, logical question people ask. And technically, yes, it's true that cooking eggs to a high enough internal temperature,
Like what temperature?
like 160 degrees Celsius or 71 degrees C,
Mhm.
basically until the yolk and white are completely firm, that can kill salmonella bacteria that might be inside the egg.
Okay, but I feel a but coming. There's a but here, right?
There's a significant but that the FDA and other health authorities really emphasize. The strong recommendation is to not consume the recalled eggs at all, even if you intend to cook them thoroughly.
Not even if cooked. Why not?
And the reason is the high risk of cross-contamination during handling and preparation.
Cross-contamination. Okay, explain that. How does that happen just from cooking the eggs?
Well, think about the process of preparing eggs, right?
Right.
You take the raw egg out of the carton, your hand touches the shell, which could potentially be contaminated on the outside.
Okay.
You crack the egg. The liquid egg contents might drip onto your hands, onto the counter, onto the edge of the bowl you're cracking it into,
Yeah.
maybe onto the whisk or fork you used to beat them, or maybe it splatters slightly when it hits the pan.
Right, I can picture that.
If that raw egg liquid, or even the shell itself, is contaminated with salmonella, you've now potentially transferred the bacteria to all those surfaces, utensils, and your hands.
Ah, I see. So even if you cook the egg you put into the pan perfectly, kill everything in that egg,
Right.
you could have spread live bacteria onto your counter or your hands or the bowl, And then you or someone else might touch those things later.
Exactly.
And then maybe touch their mouth or prepare other food like a salad on that same counter.
Precisely.
Mm.
The risk isn't solely from eating the cooked egg itself, although cooking might not be perfect every time either. It's really significantly from all the handling that happens before cooking. You could potentially contaminate other foods, surfaces, or utensils, and then get sick from that contamination, even if the specific egg you ate was technically cooked enough.
Okay, that makes the don't cook them guidance much, much clearer. It's about preventing the spread of the bacteria in your home environment, not just sterilizing the egg itself.
Exactly. So the safest, most direct advice from the authorities is simply to discard the recalled eggs entirely or return them. Don't even bring them into your kitchen workflow at all if you know they are recalled. Just get rid of them.
That makes total sense. So to reiterate, if you have the recalled eggs, throw them away or return them. Don't try to cook them to make them safe. And if you do handle the eggs, to dispose of them or the carton.
Good point. The sources also include this practical step. After handling the recalled eggs or the carton, you should immediately and thoroughly wash your hands with hot soapy water for at least 20 seconds.
Okay, proper hand washing.
Yes. And you should also wash and sanitize any utensils, countertops, fridge shelves, or any surfaces that the eggs or carton might have touched. Hot soapy water followed by a sanitizer if you have one.
Got it. That minimizes the risk of that cross-contamination we just discussed.
Exactly. Clean up thoroughly.
Good, clear instructions. Now, what if someone is listening and they realize, oh no, I think I already ate some of these specific brown, cage-free, or organic eggs with the recalled codes and dates before I heard about this recall? What should they do? Should they panic? Run to the doctor?
Yeah, that's a scenario lots of people might face. The guidance provided in the sources is actually pretty reassuring on this point. If you've already eaten the recalled eggs and you are currently feeling fine, there is likely no need for immediate concern or panic.
Okay, that's good to hear.
However, the recommendation is that you should monitor yourself for symptoms of Salmonella infection over the next few days, remembering that window is 6 hours to 6 days.
Right. And those symptoms to monitor for, as we just discussed, are primarily diarrhea, fever, and stomach cramps.
Yes, those are the main ones to be aware of. Just pay attention to how you're feeling in the days following consumption.
And if symptoms do develop, even mild ones, what then?
If you develop mild symptoms like maybe some diarrhea or stomach cramps, but nothing severe, you should continue to monitor yourself, stay hydrated. Most cases, as we said, resolve within a few days on their own.
Okay.
However, and this is crucial if you develop any of those severe symptoms we detailed earlier.
The high fever, the persistent diarrhea, the bloody diarrhea, severe vomiting, dehydration signs.
Exactly. If any of those red flags appear, then you should immediately call a healthcare provider for medical advice and potentially testing or treatment. Don't wait if it seems severe.
Okay, so if you ate them and feel fine, just monitor. If you develop mild symptoms, continue monitoring, but be aware and stay hydrated. If you develop any severe symptoms, don't hesitate to call your doctor. That seems like very sensible, practical guidance.
It is. It balances awareness and appropriate caution with not causing unnecessary alarm or burden on the healthcare system for those who remain perfectly healthy.
Definitely. Okay, we've covered the full scope of the recall, how to identify the eggs, where they were sold, the link to the Salmonella outbreak, what the illness entails, and what actions consumers should take. Finally, Section 6 in our outline touches on the current status of the company, August Egg Company, according to the sources. What is their operational status right now? Are they still shipping eggs?
Well, according to the information available in the sources when they were published, August Egg Company is not currently selling fresh shell eggs.
Oh, okay, so they've stopped shipping fresh eggs to stores for now.
It appears so. They have voluntarily paused that part of their operation in light of the investigation and recall.
That seems like a responsible step. And what are they doing with the eggs they're currently producing? Are they just holding them back, or?
No, the sources mention a specific action they've taken and apparently have been taking for a while. For over 30 days prior to the reports, they have been diverting eggs to an egg-breaking plant.
Diverting eggs to an egg-breaking plant? What does that mean in this context, and why would they do that? Sounds industrial.
It is. An egg-breaking plant is basically a facility that processes large quantities of eggs out of their shells. They often separate the yolks and whites, and they produce liquid egg products, or sometimes dried or frozen egg products that are used in, food manufacturing or food service.
Okay. And what's the significance of sending them there instead of selling them fresh?
The key process that happens to these liquid eggs at an egg-breaking facility is typically pasteurization.
Pasteurization, like with milk. That's a heat treatment, right?
Exactly the same principle. Pasteurization involves heating the liquid egg product to a specific temperature and holding it there for a set amount of time. This thermal process is specifically designed to kill harmful bacteria like Salmonella that might be present in the raw eggs.
Okay. So by diverting their eggs to this type of facility for processing and pasteurization, August Egg Company is ensuring that any potential salmonella in the eggs is eliminated before the product enters the food supply chain.
That's precisely the implication.
Instead of sending potentially contaminated raw, fresh eggs directly to consumers in cartons.
That seems to be the goal, yes. Diverting the eggs to be processed and pasteurized is a recognized measure to mitigate the risk of contaminated fresh eggs reaching consumers. The fact that the sources say they've been doing this for over 30 days suggests this measure was put in place relatively early in the investigation, maybe even before the public announcement of the outbreak link.
That provides important context about the company's response following the identification of the issue. They aren't just waiting, they've actively changed how they are handling their product output.
It indicates a tangible step taken, based on the sources, to address the problem at the source facility level while the investigation and corrective actions proceed.
Okay, we have really done a deep dive into these sources. Wow. We've covered the massive scale of the recall, 1.7 million dozen eggs.
Just huge.
The specific types of eggs involved brown, cage-free, and organic, and how to identify them by those plant codes and Julian dates.
P6562 or CA533 and dates 32 to 126.
The widespread geographic distribution across at least 9 states and numerous retailers, including Walmart.
Yeah, very broad reach.
The crucial link to a multi-state Salmonella enteritis outbreak confirmed through that fascinating detective work.
Patient interviews, facility testing, genetic matching.
The details of what a Salmonella infection feels like, the typical symptoms versus those severe red flags.
And who's most at risk?
The immediate actionable steps you, the listener, should take. Check your eggs, don't eat for cold ones, discard or return them, don't cook them, wash hands.
And monitor for symptoms if you might have eaten them.
And finally, the company's current status regarding egg handling, diverting them for pasteurization.
We've aimed to distill all the essential facts from the provided articles and the CDC update into one clear picture for you. Hopefully we've cut through the noise.
Absolutely. So let's do a super quick recap of the absolute key takeaways for you, the listener, based on everything we just covered. What are the must-remember points?
Okay, first, it's a substantial recall, 1.7 million dozen brown, cage-free, and brown-certified organic eggs from August Egg Company. The crucial part for you is identifying them. Check the carton for plant codes P6562 or CA533A and D, Julian dates between 32 and T8026.
Second, these eggs were sold under various brand names like Market Side, Rayleigh's, Simple Truth, O Organics, and others. They were distributed across multiple states, including California, Nevada, Washington, Arizona, Wyoming, New Mexico, Nebraska, Indiana, and Illinois, through retailers like Save Mart, Safeway, Ralph's, and especially Walmart. Check sell-by dates too, ranging from March 4th up to June 19th, 2025.
Third, the why behind this is a confirmed link to a multi-state Salmonella enteritis outbreak. It has sickened 79 people we know of, hospitalized 21, but thankfully resulted in no deaths reported so far. Confirmed cases are in 7 states. The link was definitively made through patient interviews pointing to eggs, positive Salmonella testing at the plant, and that crucial genetic matching.
Fourth, know the symptoms. Salmonella infection typically causes diarrhea, fever, and stomach cramps, usually lasting 4 or 7 days. But be vigilant for severe signs, especially if you or someone in your household is young, under 5, elderly, 65 plus, or has a weakened immune system. Severe symptoms demanding a doctor call include high fever with diarrhea, over 102 degrees AFib, diarrhea lasting over 3 days without improving, bloody diarrhea, severe vomiting preventing hydration, or signs of dehydration like dizziness and dry mouth.
And fifth, the most vital action step for you right now. If you have identified recalled eggs, do not eat them under any circumstances. Don't even try to cook them thoroughly because of that risk of cross-contamination. Throw them away immediately or return them to the store for a full refund. If you already ate the eggs before hearing about the recall and feel fine, simply monitor for symptoms over the next week or so. If you develop any of those severe symptoms, call your doctor right away.
Perfect. This deep dive has hopefully provided you with all the essential information from the sources to understand this specific egg recall, identify potentially affected eggs in your home, understand the risks involved, and know exactly what steps are necessary to protect yourself and your family.
Yeah, it's really about translating that complex public health information, all those details, into clear, actionable knowledge for you.
Exactly. And that brings us to a final thought for you to consider, based on everything we've unpacked from these sources. This incident, this recall of 1.7 million dozen eggs linked to an outbreak across several states. It really highlights how something as commonplace and, seemingly simple as an egg
Right, just breakfast.
can be part of an incredibly complex and interconnected food supply chain. It's kind of mind-boggling when you stop to think about it.
Think about it. From a hen laying an egg on a farm somewhere, to that egg being collected, washed, graded, packed at a facility like August Egg Company in California. Then transported, possibly refrigerated trucks going thousands of miles across state lines, passing through distribution centers, arriving at all these different types of retailers, from huge national chains like Walmart to regional grocery stores.
Yeah.
And finally ending up in your shopping cart and then into your refrigerator at home.
It makes you appreciate just how intricate that journey is for such a basic food item. And simultaneously, this event showcases the vital, often invisible work of public health agencies like the CDC and the FDA.
Absolutely.
It took skilled investigators using patient interviews, environmental testing at the plant, and that advanced genetic science to connect these scattered cases of illness in different states back to a single specific source facility.
That level of surveillance and that kind of epidemiological detective work is absolutely essential for identifying and containing outbreaks in our modern globalized food system. We wouldn't have known without it.
No way. It's a reminder that ensuring the safety of the food on our tables involves this vast network of producers, distributors, retailers, and importantly, public health officials working together.
And sometimes, identifying when a link in that chain is broken down or requires urgent public attention, like with this recall, it definitely leaves you thinking, doesn't it, about the journey of your food and the systems that are there to protect it, or at least to catch problems when they arise.
It really does. Something to maybe ponder the next time you're in the grocery aisle looking at all those different egg